Thank you, and I'm really happy to be with you today to talk about this timely topic. And the focus of my presentation will be mainly on looking at the air pollution and how it may affect COVID-19. May not necessarily talk about much about how it affected the air quality due to the lockdowns, but really much the health side of things. So we'll briefly go over the epidemiological evidence that has been published so far. There's been so many papers that have come out in 1 year, and what has been done in Canada, because yes, there's been research already done in Canada, and the limitations. I hope it will sort of raise awareness today regarding this association, but also for you to understand sort of the possible limitations in this scientific literature, because it's evolving so fast, and we need to be careful about over interpreting the science. So, what's the evidence of air pollution in COVID-19? The one thing we know is that there's a lot of epidemiological evidence, so studies that have been published looking at chronic, so long-term exposure to air pollution and short-term exposure to air pollution. When I'm referring to short-term, it's really just the daily fluctuations in air pollution. And we know that those studies have shown that it exacerbates symptoms of respiratory diseases. And now, in the last year, there's been quite a number of studies that have shown associations between air pollution and COVID-19, whether it's looking at case rates or mortality. And I'm just bringing your attention to a few reviews that were published in recent months. If you're interested in knowing more about the topic and you'd like to read on this topic, I've highlighted a few of the recent review articles. The first one by Bert Broncrief, a very excellent researcher in Europe, published a review for the European Parliament on the evidence so far, and they went over sort of the biology of all of this. So I think this is a very nice review article. And one thing I can say is that there's sort of two types of studies that have been published in this literature. It's really about the long-term exposure. So whether people who are exposed to air pollution over a long period of time, has this increased their vulnerability in being infected to COVID-19 and perhaps having more severe outcomes of COVID-19. And so those studies so far are mainly ecological designs. So ecological designs are a very specific type of epidemiological study, and they are not necessarily the best design, but they still are interesting because they can raise awareness and bring forward new hypotheses that have not been investigated before. So the studies so far have been published in China, Europe, USA, and Canada. And usually what those studies are doing is that they're looking at regional level or county level or city level exposure to air pollution over a long period of time. And they're looking at the daily number of cases of COVID-19 or the daily number of mortality events due to COVID-19. And sometimes they're adjusting. As you know, it's important to adjust for confounding variables, and they're adjusting for population density, socioeconomic status, and a number of other indicators. And this is just an example of a study that was done in Canada that was published in 2020 based on the spring 2020 COVID-19 cases across Canada. So as you may be aware, Canada is divided in health regions. There's 111 health regions in Canada. And what colleagues in this study did is that they looked at the long-term exposure to air pollution in each of those health regions. So on the left, it would be the PM 2.5 levels. And then on the right, these are the case numbers. So the number of cases that is sort of summed over the whole period that they investigated. In this case, it was mainly looking at the spring 2020 of cases. So this is just to give you an idea of what an ecological study design is, because it's not an individual level study. It's a type of study design that looks at area level. And what those studies have found so far, either the one done in Canada or done in the US and China, is that they found positive associations between PM2.5, so the exposure to PM2.5 over a long period of time, and the incidence or even the mortality to COVID-19. But the thing is, there was a large range of effects. So as you know, in epidemiology, or as you may know, in epidemiology, we usually quantify the risks using, like, for example, a relative risk, and we would compare what would be an increased risk compared to a baseline. And usually when we look at PM2.5, we can quantify the risks for each increase in 1 microgram per cubic meter of increasing air pollution. And sometimes studies were showing risks that are always almost null, and sometimes the risks were almost 20% increasing for each 1 microgram per cubic meter of air that's increasing. So large range of effect. And some studies also found some associations with nitrogen dioxide in relation to the incidence and mortality to COVID-19. And there was actually one study, interesting, that was done in the UK that was actually that's the only one so far that I'm aware of that looked at individual level exposure using UK biobank data. And they actually found conflicting results with respect to air pollution exposure. It's when they accounted for some confounders in their models, they didn't really see much associations, and they actually saw that air pollution exposure was associated with the probability of being tested. So perhaps in areas with higher levels of air pollution, people were actually getting more testing done. So that's one thing to understand in this type of literature, is that there are findings, and you may have seen those perhaps reports in the media showing that air pollution may be associated with COVID-19, but we always need to be careful about those findings because there are limitations at the moment in this literature. Now, the other thing is that the studies also looked at the short-term exposure to air pollution. And most of these studies are time series. So a time series study is a type of study design that we looked at daily variation in air pollution and the daily number of an outcome. In this case, it would be the daily numbers of COVID-19 or the daily numbers of mortality events. And again, studies have been conducted in similar areas that the long-term studies have been done. And they adjusted for a number of confounding factors. So for example, weather parameters like temperature, humidity. Some studies even adjusted for UV radiation because there has been some hypotheses underway that UV radiation may be associated with perhaps less transmission of the virus. And they also, some studies adjusted for the reproduction number, the effective reproduction number, or even the lockdown periods that were underway. So without going into all of those details about why did they adjust for those confounders, what I can say is that those studies so far have found some indications of associations or even correlations between air pollution and COVID-19. So in other words, they were able to find those studies, they were able to find that daily fluctuations in air pollution could actually be associated with the daily increase in the number of cases of COVID-19. But one thing again here is that the effect estimates, the risks, varied a lot from one study to another. And that's something to keep in mind because whenever we're trying to assess the robustness of the scientific literature on a topic, we're always trying to sort of figure out, is there consistency in the findings? Are we seeing similar magnitude of effect? And this is not necessarily the case at the moment with the current scientific literature. The other thing is that the lag periods varied a lot from one study to another. So by lag period, I'm referring to, let's say that we're looking at the increase in the numbers of cases on one day. Is it due to the air pollution on that day, or to the air pollution exposure on the previous day, or 2 days before, or 5 days before? So the lag periods from one study to another were actually quite different. And some studies only looked at correlations. And if you're familiar with the scientific terminology of epidemiology, we know that associations is not necessarily the same thing as looking at correlations. And one thing about time series studies is that time series studies usually are conducted over a longer period of time, because we are able to account for seasonal patterns, seasonal effects, because as we know, air pollution might have seasonal patterns. And therefore, if they only looked at a few months of exposure to air pollution, it might sort of not be most adequate to be able to account for seasonal patterns. So this is sort of what I found by doing my own literature review about studies that were conducted worldwide. And earlier I mentioned this study that was conducted in Canada by some of my colleagues at Health Canada. And they actually, this study is interesting because they looked at 111 Canadian health regions, so including regions in the Atlantic area, in Quebec, Ontario, and so on. And they accounted for a number of covariates. So again, those covariates that were accounted for are area level covariates, so not individual level. And I want to emphasize this aspect because it's important in understanding those findings, because we always have to be cautious about interpreting ecological studies. But still, in this study, they were able to find that, and simply bringing your attention to this first result up here. Basically, this means that for every increase in 1 microgram per cubic meter of air of PM2.5, they found a 7% increase in the daily number of cases. But then when they limited their analysis to the most heavily affected provinces in the first wave of this pandemic and epidemic in Canada, Ontario and Quebec, they actually found that this risk was 1.21, so a 21% increased risk. So again, it's important to have these findings, but we always need to be cautious about those findings. And they identified a number of limitations in their study. Not necessarily going to go through all those limitations, but all to say that one important limitation, again, is the fact that the study was done at an ecological level and not at the individual level. And so perhaps those areas that have seen associations with air pollution and the daily increases in COVID-19 cases may also be areas that actually have perhaps more testing, or areas that have a higher population density. Although they adjusted for population density in their analyses. So interesting findings. And myself and colleagues, we are currently working on some analyses looking at the daily variations in air pollution in Canada. And we obtained emergency department visits in 2 provinces in Ontario and Alberta. These were the only provinces at the moment where we could access emergency department visits for COVID-19. So at least we got individual level information, and we were able to look at sort of the daily concentrations of specific air pollutants, PM2.5, NO2, ozone, and we also had temperature and relative humidity in our models. And we looked at the daily variations of air pollution on the likelihood of seeing an increase in emergency department visits for COVID-19. And in our models, we accounted for the effective reproductive number. So this is the R value that we keep hearing about in the media. And why did we account for this? Because it was a method for us to account for the transmission probability. Because perhaps when the transmission probability is increasing, it affects obviously the number of people going in the emerge, but it could also affect perhaps the levels of air pollution in the sense that more stringent measures are being implemented to reduce people's contacts, and therefore people using less their cars and having reductions in air pollution. And we also used a government response index that is being provided by the University of Oxford in the UK, that is also a measure of how stringent measures are being implemented. So we accounted for those factors because these can be what we would call confounders in epidemiology. And we also accounted for health region level information, for example, population density, which was the most important one that we accounted for, and a number of other factors. And without going into too much details about the stats, we did this is a case crossover study. So this type of study design in epidemiology is a study design where we compare someone who's been admitted to the emerge to themselves at another time period to see whether the days preceding the emergency department visit were actually associated with higher levels of air pollution compared to other days within the same month of that same person, in order to see whether it was actually the air pollution that triggered the person to go and require health services. And all to say that we were able to get about 22,000 emergency department visits in this analysis, and being able to have also information on age, sex, COVID-19 case status, whether it was confirmed by lab testing or suspected case, which was not confirmed by lab testing, but was suspected due to contacts with other people who had COVID-19 diagnoses. And these are the daily concentrations of the variables that we use in our study. So again, focusing only on Ontario, so all of Ontario, all of the health regions across Ontario, all of the emergency departments, hospitals in Ontario, and also in Alberta. And here are some findings. I think it's interesting because what we see so far, and we're writing the paper at the moment, we're planning on submitting to a medical journal, but what we are basically seeing is that when we looked at the effect of air pollution on COVID-19 emergency department visit, and we're looking at the lag period. So again, the lag period is, for example, a lag 0 would be on the day of admission to the emerge for COVID-19. Is the air pollution on that day associated with the risk of going to the emergency department? And is it related to 5 days before, or is it related to 10 days before? Because we're trying to think about, well, is it because you're exposed 10 days before that then affects your level of immune defenses and then perhaps increases your risk of being infected? But actually what we see so far with, for example, PM 2.5 is the risk is mainly limited to the day of admission. So the red line is sort of the risk estimate, and the dashed lines are the confidence interval. So anything that is under the 1 value is actually not significant on a statistical point of view, but anything that's above the 1 value is statistically significant. So what we're seeing is results are statistically significant, mainly limited to the day of admission to the emergency department. And we're seeing the similar pattern for nitrogen dioxide. So again, this increased risk of being admitted to the emergency department uh, and for COVID-19 due to the increase in nitrogen dioxide. And we didn't see any effect for ozone. It was just totally null, nothing at all going on for the exposure to ozone outside. And without going into too many details about this table, where I want to bring your attention to is this result at the bottom, because we decided to look at the result, but stratified according to different characteristics. And one thing we found that's interesting is that for those that had pneumonia accompanying COVID-19, because we know that you can get COVID-19 and you can also have a more severe COVID-19 diagnosis by having pneumonia with COVID-19. And the effect of air pollution on COVID-19 among those that had pneumonia was actually higher. So the effect estimate was 1.22, but the effect estimate for those that did not have pneumonia was actually lower. So in our study so far, we found some evidence of an association between short-term exposure to PM 2.5 and NO2 on COVID-19 emergency department visit, and the effect appeared higher among those that developed pneumonia. So there's perhaps mechanisms that are involved in the sense that there may be an impairment of antiviral immune defense due to air pollution, or even whenever someone is infected to COVID-19, being exposed to air pollution may sort of modulate the inflammatory process and perhaps enhance the inflammatory process. And we know that there's been previous studies that looked at acute exposure to air pollution on respiratory infection, whether pneumonia or influenza. And those studies have found associations between air pollution and the risk of respiratory infection. So, keeping in mind some limitations of the current evidence, and I'm almost done. Again, like I said earlier, the ecological approach can be limited, but it can still provide insights on what is the relationship between air pollution and the risk of COVID-19. And we know that there may still be confounding factors and limitations in the methodology that's being used, because there's so many other things that can be related to this relationship. And one thing I can say, concluding on this topic, is that so far, based on my own interpretation and what I've been reading from credible sources looking at the scientific literature on this topic, it doesn't seem to be compelling evidence, but this should not be interpreted as suggesting that air pollution is not contributing to the occurrence of COVID-19. And further research is needed, involving perhaps individual level data, population data on whether we know where people live and how likely they're exposed to air pollution where they live, and having information on their personal information, and incorporating their person-to-person contacts and social interactions. And I know this is complex, but it's perhaps this type of information that will provide us a better understanding of this relationship. So I'm including just some references that you may be interested in looking at. Some researchers have published also on methodological considerations in those types of studies that have been published so far. So things to keep in mind. And it's a pleasure to be presenting today, and happy to answer any questions.